So to begin, I will invite the representatives of the Jordan Principle and the initiative called Inuit Children First, to introduce themselves. Hello, Philippe Mackay. I work at the Minister for First Nations Services. I worked on the Jordan Principle for 7 years. And I'm very happy to be here today amongst you and talk to you about this initiative and how it can be used to help the First Nations communities with which you have contact. Hello, Karine Boyer. I am the Jordan Principal. I am the manager of the team that treats the requests from the friendship centers, from the Cree community, from the Innu community, and for all of the rest of Quebec as well. But we will also answer questions from the communities and about the communities, because we work a lot on these files from the different concerning the different communities. So Karine is there. If she can introduce herself. Of course, we're not going to go through the whole thing, the whole principle, but there's a premise here behind the Jordan's principle and the initiative, the Children First, that seeks to help Inuit children. We're not going to go through the whole thing. There's a slide in the presentation where you can have more information if you wish, and the contact information if you want to inform yourself further. I don't know if Karine is there, if she wants to introduce herself. She's not here yet, it seems. Do you have access to your microphone? Hello, Pascal. I'm her colleague. She's having problems connecting. She will be with us soon. Thank you. Anyway, we have the emails. If you have any questions, it's in the slide deck. There's contact information if you need to ask Karine any questions. Thank you, Philippe. Philippe, do you want to begin sharing your screen? I will do that. Do you see my screen? Great. So to begin, before we get into the technical side of things and how we make requests, and it's important to understand where the Jordan's Principle comes from. So this initiative is named in memory of Jordan River Anderson, a child from the Cree Nation, from Manitoba, from Norway House. He is was born in 1999 with many complex needs of a medical nature, and he was hospitalized for a long time. And after 2 years of hospital stay, the doctors were of the opinion that he could go back to the family environment on condition of having house care services, 24/7 home care. So what happened is the governments, the federal and provincial governments, had a dispute as to who would take on the costs, because it's a First Nations community, and it lasted 3 years of fighting, and unfortunately the child died and could never have access to adequate care. So that is where the Jordan's Principle comes from. We're going to talk about the mandate associated with that, but it's really to make sure that it doesn't happen again, this kind of situation. So that's what gave rise to the Jordan's Principle. The idea is to make sure that all children have access to social services and healthcare, education in the appropriate time and in the appropriate way when they need those services, and in avoiding this kind of dispute, independently of where it is needed, the service is given. And then if there are any disagreements, we'll take care of that after the fact, after the services, needed services are given. So the important thing about this initiative is to make sure that healthcare and social services are adapted to the culture and that meets the real need and real equality test. So we're going to look at that. What does it mean, true equality? It means that not all children who there are certain children, it's not just for children, but it's a principle that says that each individual has particularities, has special characteristics. Everybody is unique. There's marginalization, there's racism, there's all kinds of factors, social isolation, and isolated communities that don't have access to the same services sometimes. So we have to consider all those things and adapt the services and offer adequate services that are needed so that they can have the same chance as the majority of the population. So, who is covered by the Jordan principle? All the children under a majority in all communities, independently of where they are in Canada. So the child must be a status Indian, it has a status card. If he's not registered, it could be a parent or a legal guardian that is has a status card, or somebody who is not a status and who lives in the communities that is recognized by his nation as a member of the community. They will be covered by the Jordan principle as well. So it's important to know that this is something that is important to develop collaborations. When you have minors and children who have some issues and services are not accessible or funding is not accessible for all kinds of services that are needed, there are products as well. There are coordinators in place in the communities in Quebec and also in most of the friendship centers for people who live off community. There are people there who are very important because they know the needs of the community. They know the services that can be available. They're like liaison officers, if you will, that could connect with the different programs that exist and to ensure access and taking charge of covering the needs and offering the services in an adequate way. So it's really important what these people do, what these persons do to have relationships with these people. If you meet up with these kind of situations, and these are the people who you will meet who will help our young people. So their role is to act as a support for people who have, and families who have needs, and to connect with the different health and social services networks of the communities and the schools, the education and social services to make sure that there are no gaps and that everybody is covered and all the children's needs are adequately covered and met. So what is important when there are specific needs that that you cannot have access to directly, it's important to try and look at what programs exist that can offer these services before presenting a request and ask for the Jordan principle. If you're not sure, you can talk to coordinators and who will inform you, but it's really important to understand that the Jordan principle is there to fill the gaps. There's an order of the court, a mandate of the court, the Jordan principle, so that sometimes people go directly to that because it's the faster way, the easier way, but it's important to look at the access with current programs to make sure that the services are available there first. Because if not, it kind of colors the budgets and the data, and it can affect the programs. So For making a request, what is needed to do, you have to fill out some forms. It's not obligatory to do so, as long as the necessary information on the child, who the parents are, the legal guardian, and what the needs are. You have to specify the objectives of the request and the needs, and you need a recommendation. We're going to see what the recommendation has to contain and who it must come from. The recommendation from a professional. There are costs associated with that. The cost has to be detailed, and it requires the consent of the legal guardian or parent, the person responsible for the young person, because young people under 16 cannot do this on their own. So the recommendation is really important, that is done by a professional, that is a member of a professional college, and that is directly involved with the child or the community, the group that the child belongs to, and that has to know the child and understand the needs, and to be able to identify or the child's needs, or a group of children has to be identified. And you have to also identify everything that is needed very specifically and very precisely, and connect that with the need that must that we need to answer. So when the requests are sent, these are the emails for First Nations children. It goes directly to the Minister of Services for the First Nations community. So there's the email there. I'm not going to get into detail for Innu children. It's a process that is pretty much the same. The same mandate covers both of them, but it's a process that's a little bit different. It's not exactly the same. It goes through the Régie. So that's the address where you have to send that. And this is the information with the email, and you've got the QR code there that you can scan, that will have more information for you. And it's important to note that all the children on Innu territory, that's taken care of by the province. So it's similar, the programs are similar, but there are services that are available there that are different. So it's important to go through them, and to send your email to the right place. So how the requests are processed: once we receive one, we open a file. It's transferred to an agent who will do the analysis, who will contact the stakeholders if he needs more information, if they need more information. And once approved, there's an approval letter that will be sent, and there will be follow-up actions with the funding and the services needed. And it's important to note that at the minister level, we don't have the authority to refuse. So if a request, we can't approve it for X and Y reason, we don't have the authority with certain types of requests that requires it to be pushed up to the national level, where maybe we need to provide more information, where there could be lots of reasons why we can't handle it ourselves, and we have to push it up to the national level, and then we will get an answer. And there will be a follow-up letter that will be sent. And if we need more information, then we will have further processes to get information from the different parties. So that is the process to pay for services. The idea is we eliminate as much as possible the administrative load on the families. So the coordinators have an important role here. The liaison officers, they can take charge of paying the bills, the invoices, the suppliers that they have to find and accompany them through the process. Sometimes it'll be the parent who will send us the invoice directly, or the bill, or it could be a stakeholder, somebody who is in our network who is giving us support. And then at that point, the payment will be made, ideally directly to the supplier, to avoid undue administrative tasks for the parents. But it's possible also that in certain contexts that it will be parents who will ask to be refunded so we have some contribution agreements with the different communities, with the friendship centers in urban centers, and centre de service scolaire, scholastic service centers as well, everything around education. So in this way, it's easier to avoid undue administrative work for the families. So if you have any questions, there's information here. There's the website. If you have any questions, you can email us or go to the website. There's also the address for the request, and there's a call center available 24/7 that you can call, and the number is up on the screen. Hello, Marie-Christine Gendron is my name. I am a liaison nurse at the DSN program for the Quebec region. I'm the person responsible for exceptions, exceptional requests, and I work with the different healthcare professionals for information required for processing requests. I am happy to be here among you and happy to work with you. So I can continue. My name is Dominique Brière. I am the main manager of the program for non-insured health services for east of Quebec, for the East Quebec region. I can now hand over the microphone to Metaxia. Hello, everybody. My name is Metaxia. I am a manager for the SSNA program for Quebec region. I am responsible for medical equipment and vision care that we're going to talk about today. So I'm happy to be here among you. Hello, everybody. I'm happy to be here with you. I'm like Metaxa. I'm the manager for treating these requests, and I am responsible for medical transportation and counseling. Thank you. So I will begin with the presentation. Marie-Christine, if you want to go to the next slide, please. Thank you. So this is the plan of the presentation. We will cover the following points. So I will do the first parts. We will start by presenting the objective of the program, why it was created, then the criteria for admission to the program, for eligibility, the management of benefits. It's not all programs that are administered at the regional level. We at the regional level, our offices are in Montreal, but there's part of the benefit that is administered at the national level in Ottawa-Gatineau. So we're going to present that later on. And we thought that it would be relevant for people here among us today to hear us speak more specifically about the process of how we treat these requests. We have three specific cases that we wanted to cover around the process. So we tried to really give you the most relevant information. So you can see here on the screen. Are there any questions? Okay, so as you can see, we're going to get into more detail on how to make requests for medical transportation, medical equipment and supplies, and medicines. So we will give you information and links for this program. So the objective of the program of NIHS, Uninsured Health Services, to offer a coverage for a range of services that are not insured, so that are not covered by other programs for health and social services, by private insurance, or by provincial or territorial insurance. So for Quebec, it would be REMQ. Next slide. So to be eligible, a person must be a member of a First Nation covered by the Indian Act, or a child under 2 years where the parent is eligible. So the parent uses the number of the parent, the health number, and that is done to give time to the families to register their child. So up to 2 years, you don't need to have your own registration for each child doesn't need to have their own registration to benefit from the program. Another possibility is to be an Inuit recognized by an organization, a land claim organization that is outside of the territory covered by the land claim, because on the Inuit territory, they have their own program. And if they exit the territory, they are covered by us if they obtain a number that is required to have access to our services. To be eligible, I already said that the clientele of the SSNA of the NIHS is pretty young. The average age of our clients are 35 years old, but we have all ages for non-insured health services. So in the last years, the program, we saw an older population, trend towards population being a bit older. So the people are eligible independently of where they live. It's in Ontario where we have the biggest proportion of the population that is eligible. So a quarter of all the eligible people in the country are in Ontario, 9% for Quebec, and with the data we have with the program in 2023, it was a bit more than 83,000 persons. So next slide. This is what I was speaking to earlier when I presented the plan of the presentation, is how our services are organized. You see on the left are the benefits that are managed by the national level in Ottawa, Gatineau, for most of the country, and it's centralized there. For the benefits for medicine and health, dental health, and there's the regional part as well in the regional health call center. So medical transportation, medical supplies and equipment, vision care, and counseling and mental health. We have in green the benefits for which we decided to present the process to make a request. So I'm not going to go through all of that in detail. I'm going to let my colleagues do that. I just want to say very quickly a few words on the other benefits. So dental care that are managed at the national level. It's a program that covers a range of dental services that are described in the guide. The benefit guide that is available on the web. I'll give you a few examples. I have diagnostic services, for example, x-rays, diagnostic x-rays, so cleaning, restoration of teeth, for example. So if we go to the benefits that are managed at the regional level, the healthcare counseling program, there's a program that covers services for health, for mental health and well-being. Services can be available for clients. We supply those in the community, and it's eligible for people who don't have access via their SSN. We are always the last payer, and the health vision care as well, benefits that cover eye exams and the repair of glasses and prescriptions for glasses as well. So for the next slide, I think that it's my colleague who will present the program and the process to present a request. So, as mentioned, this program is managed at the regional level, and I wanted to mention that the majority of the management of the services of this program was transferred to the communities for almost all the First Nations communities in Quebec. They have people that are working and covering these programs. Medical transportation, for example, they have a coordinator for medical transportation. For example, they organize that, and they take all the information, and each community has their own coordinators. And if the person doesn't live in the community, the person has moved into an urban area, they become eligible to have services under our program. So why transportation for medical reasons? This program seeks to help clients to have access to medically necessary services that are not available in their community or region. So it's make healthcare more available and more egalitarian, more equal access for everybody. For the transport to be eligible, it has to be a service that is covered by the RAMQ, and it is a medical transport to have access to services at the private sector is not eligible. It's only for services covered by the RAMQ or covered by non-insured health services. For example, it can be for vision care or dental care. It could be a psychologist for therapy, etc. So eye test, for example, for medical equipment also. So the transportation can be eligible for the person that needs a treatment for addiction in addiction treatment centers. There's a program at the national level for alcohol and drug dependency, and we heard the acronym. The acronym is up on screen there. In Quebec, there are 600 of them. So if the person can receive treatment, we will pay for their transportation to therapy. And these are the instances where the medical transportation will be covered. There are a few general principles that we apply to determine medical transportation. The transportation must be done to the appropriate and closest professional. So if a service in Basse-Côte-Nord, for example, the closest service would be considered Sept-Îles, and the closest service will be in Sept-Îles in that case. So we will provide transportation towards Sept-Îles. But if this service is not available there, we will look at the closest point where the service can be offered. And also, the means of transportation must be the most practical and most economically viable. Of course, we have to consider the condition of the person being transported. If, for example, the person has a condition that makes it so that they cannot be seated for long periods of time, we will use airlift in that case. Or if you need a medical justification by a professional in that case. So that's where we really need the collaboration to have a medical note that will describe the limitations of the person being transported. That helps us to select the most appropriate mode of transportation. For example, if the person has a condition where they can not take a plane, it can endanger them, for example. So we are not healthcare professionals, but we are happy to have and lucky to have Christine among us, who can give us her help on that. So an accompanying person can be authorized under certain conditions and upon recommendation of a healthcare professional in case of medical or legal necessity, or if there's a language barrier. In those cases, again, we need the collaboration of a professional to authorize the transport. We have a justification for professional. The ambulance costs are covered, except for people 65 plus. And when it's a transfer between hospitals, because these instances are covered by the provincial transport program, and because it's covered, the NIHS will not cover it because it's covered at the provincial level. So next slide. Here you can see a flow chart on how we organize the process, how we treat these requests. Maybe you're used to hearing from the patient, but the medical appointment has been given, and we see that this service is not available locally. In this case, a request is made for NIHS and the community. As I said, it can be a transport coordinator from the community, or it can be done through a call in our call center. And the coordinator or the call center person processes the request.
Envers, c'est où votre implication est nécessaire. Si on a besoin d'une justification médicale, on va la demander. Ça va nous aider à prendre une décision éclairée. Ensuite, le client obtient son service, il rentre au rendez-vous. Et un autre point où on a aussi besoin de votre collaboration, c'est nous avons besoin absolument un certificat de présence pour avoir une confirmation que le client a effectivement se présenter au rendez-vous. Donc, ça, c'est des grandes lignes, comment la prestation fonctionne. À la fin de présentation, nous avons mis le lien au cadre de travail sur le transport pour raison médicale de notre programme. Donc, si vous voulez comme creuser un peu plus, vous êtes bienvenus d'aller et regarder, suivre ce lien et regarder. Et je passe la parole à ma collègue Métaxia. Merci de votre écoute.
Ça va être moi qui va continuer, Camilla.
Je m'excuse.
Il n'y a pas de souci. Je vais vous parler des équipements médicaux et des fournitures médicales qui sont couvertes par le programme des services de santé non assurés. Ces équipements-là doivent être prescrits par un professionnel de la santé reconnu par notre programme. Ils peuvent être couverts par les SSNA si ils ne sont pas couverts par la RAMQ. Les SSNA sont le dernier agent payeur. Doivent être inscrits sur la liste des prestations des SSNA. Il y a un guide et des listes complètes sur le web qui sont disponibles qui contiennent beaucoup d'informations. Les équipements médicaux et les fournitures médicales sont autorisés lorsqu'elles sont liées aux activités de la vie quotidienne du client et lorsqu'elles sont utilisées à la résidence principale du client. Des exemples de catégories de prestations pour les équipements médicaux, fournitures médicales, il y a 12 catégories, mais principalement, je vous dirais l'oxygène, les accessoires, fournitures respiratoires comme les CPAP et les fournitures médicales qui comprennent les pansements, les produits d'incontinence, produits urinaires sont entre autres des exemples de catégories de prestations couvertes par le programme. Je vais vous parler du processus de présentation des demandes pour les fournitures et équipements médicaux. Donc, au départ, on a une prescription médicale qui est par un prescripteur reconnu par le programme. Cette prescription-là, elle est donnée à un fournisseur des SSNA. Donc, toutes les pharmacies sont enregistrées avec notre programme. Sinon, ça peut être aussi un fournisseur spécialisé d'équipements médicaux qui est déjà enregistré avec notre programme. Le fait que de faire affaire avec un fournisseur enregistré, ça l'évite au client à payer. Donc, c'est vraiment le programme qui paie directement le fournisseur pour éviter que le client ait à défrayer des frais. Lorsque le fournisseur envoie sa demande d'autorisation à la région, on va traiter la demande avec les informations qui sont requises. Il y a une décision qui va être rendue. Je veux juste revenir, ça se peut que dans la demande, on ait besoin de justification médicale au besoin parce que dans les catégories de prestations, il y a parfois des fréquences de produits qui sont autorisés pour une fréquence donnée. Donc, des fois, on a besoin d'explications pour dépasser ces fréquences-là. Donc, le traitement de la demande par le programme à la région, la décision qui est rendue par les SSNA, donner au fournisseur son approbation pour que le client obtienne ensuite son service. Ici aussi, en vert, on a mis quand on a besoin de votre intervention là, en tant que professionnel de la santé, soit pour la prescription ou pour la justification médicale au besoin. Alors, ça fait le tour du processus et des équipements médicaux. Je vais passer la parole à ma collègue Métaxia pour la dernière section des médicaments. Il nous dit qu'elle a un problème. Attendez, j'ai pas accès à mon... Je peux peut-être continuer?
C'est qui devait faire cette partie-là, Marie?
C'est Métaxia. Mais là, elle vient de m'écrire dans Teams qu'elle a un programme, mais là, j'ai comme pas accès à mon Teams parce que je suis en partage d'écran. Fait que je peux continuer, là, si c'est OK.
Parfait, ben oui. Juste mentionner, là, on a notre interprète qui a, je sais pas si sa connexion a coupé, mais en tout cas, il est plus là, dans la salle.
OK.
Donc, la traduction a coupé, mais on essaye, là, de le récupérer.
Préfères-tu qu'on attende un petit peu?
Non, je pense qu'on va essayer de garder notre timing, là, d'activité.
OK.
Mais au pire, dans le montage, là, on essayera de récupérer ce bout-là en anglais.
OK, parfait. Donc, les membres des Premières Nations doivent obligatoirement accéder aux médicaments à travers le programme fédéral des SSNA, des services aux Autochtones Canada. Ils n'ont pas accès au régime public d'assurance médicaments du Québec. Donc, c'est vraiment une particularité importante. Une autre chose aussi, c'est que la liste des médicaments des SSNA est différente de la liste des médicaments RAMQ. Et c'est quand même très important à savoir en tant que professionnel de la santé qui pouvait prescrire un médicament quand c'est pour un client autochtone. Donc, les deux listes sont différentes. Pour les SSNA, on a 4 catégories de médicaments. Il y a les médicaments en vente libre. C'est la liste des médicaments SSNA. Il y a les médicaments couverts sans restriction, les médicaments à usage restreint qui ont besoin d'une approbation et des médicaments d'exception. C'est vraiment important de rappeler là, que les médicaments sont tous gérés par le national, par Ottawa. Donc, c'est vraiment eux qui détiennent l'information, les critères qui reçoivent les demandes. Et les médicaments génériques sont offerts d'emblée. En ce qui concerne le processus de présentation des demandes de médicaments, ça commence toujours par une prescription. Le client va à la pharmacie. Si c'est un médicament qui est sans restriction sur la liste des médicaments SSNA, le client obtient son médicament tout de suite. Si c'est un médicament qui nécessite une autorisation préalable, le pharmacien, le fournisseur, là, va faire une demande d'autorisation au centre d'exception des médicaments qui va analyser la demande. Là, je vois moins la section sur le côté. Qui va analyser la demande au centre d'exception des médicaments. Ça se peut qu'il y ait un formulaire qui soit envoyé au prescripteur par télécopieur. Et ça, c'est souvent un enjeu parce que le centre d'exception ne rendra pas de décision tant qu'il n'aura pas l'information complémentaire au médicament qui a été prescrit. Et ils envoient toujours le formulaire au prescripteur qui a émis la prescription. Donc, le prescripteur se doit de compléter le formulaire et de le retourner au centre d'exception des médicaments qui aura toute l'information en main pour rendre une décision et éventuellement que le client obtienne son médicament.
And eventually the client will obtain their medication. And here in green, we have the sections for the participation of the healthcare professionals. That is where it is required for prescriptions and to complete the form that is sent by the Centre d'Exception, the exception center for a particular request. So that is it for us. We have the coordinates, the information, the contact information. and for the regional center Monday, Friday, and the Center for Exceptional Medication. There's a phone number in English and French. There are links as well for the guides for the content that we have presented. So that is the presentation for us, and I will stop sharing my screen. So I am back. Do you want to add anything? Well, because I got cut off, but I think that Marie really explained the importance of understanding that our clients are not covered by public insurance for medication. That's really important to understand. The list of exceptions is published in our site, where the prescribers have access when they want to prescribe medication for the client, and all the criteria are on the list of medications. So, for example, for medications that are limited use, there will be criteria on the list of medications. The process that Marie talked about, most of the medications are covered without restriction. So a client can go to the pharmacy, it goes through directly, but it takes approval, and that's where we need the prescriber, when he will receive the form for acceptance in medication, to complete it and return it to client to be able to have their medication. So I think we've covered all of that. Thank you. Perfect. Thank you to all of you. I think we're not going to take questions right away, and we want to keep time. We've kept a note of all the questions. Don't worry. Those who have asked questions, we will answer them at the end in the Q&A. So now for this last portion of the presentation, so for the FNQLHSSC, the organization that accompanies people in their needs for health care. So to share the screen. Do you see the presentation? But you're not in presentation mode. If you can do that, and show us the whole page. So I will do that. Does it work? Great. So Geneviève, I will let you begin. Perfect. Hello, everybody. Geneviève Boyer. I am the team lead at healthcare at the FNQLHSSC, and I'm going to just explain the acronym. We are a bit different from the SSNA and Jordan Principle. We're going to talk about that, but I just wanted to take a few minutes to present our organization for those who don't know it. So maybe you can go to the next slide. So we are an organization from the First Nations for the First Nations. And if you can just jump slides. Yes, please go to the next slide. I lost the presentation. I'm sorry. Okay, so maybe I can move the slide over. Okay, I've got it. Okay, so I was mentioning earlier that we're an organization of the First Nations for the First Nations. Throughout Quebec, there are commissions and organizations, regional organizations, that are under the Assembly of First Nations of Quebec and Labrador, other organizations than ours. Ours is for health and social services, but there are other ones, sustainable development, Youth Network of Nations, the Economic Development Commission, the Natural Resource Development Commission, the Educational Center for First Nations. You can see the regional structure here. We are not a government institution. We are really there to serve the First Nations under the governance of the chiefs of the First Nations, the NIHB. So our vision and our mission statement, the mission, I will start with that, to accompany the First Nations of Quebec in reaching their objectives in terms of health, well-being, culture, and self-determination. You can see here, there's a part that covers social services and health. And we have other important sectors. Our vision is the persons, families, and communities from the First Nations be healthy and have equitable access to health care services of quality and exercise their self-determination and cultural autonomy. So that is the vision of our organization in terms of cultural security. Next slide. So quickly, we developed our new strategic plan. What we wanted to mention here is this strategic plan is really developed in collaboration with the communities. So there are consultations with the chiefs and the different stakeholders and health care professionals, so that we are aligned. We have the axes that we work on, the four main pillars: governance and self-determination, accompaniment to reinforce capacities, defense of interests, and operational efficiency. So quickly, the sectors we cover: we are a health and social services organization. We have many teams: social development, communication, research, information resources, early childhood, governance. Governance is a team that very recently, I think 6 or 7 years, that we work in collaboration with the communities that propose and submit to take charge of the responsibility for health and social services. Regarding the federal government, there's a process in collaboration with the communities to propose a model that they can take on responsibilities for health and social services. And finally, what I see here to draw a portrait of the services that we offer: there's the accompaniment part, there's also development tools, training, management of information, and defense of interest. We develop tools that are adapted to the First Nations to make sure that it all makes sense in all languages for them, English and French. We also have training, management of information. We have a research team that gathers information and with the communities that they can use to identify their priorities for health and social services, defending their interests. And so that gives you an idea of what we are as an organization, and we'll certainly be happy to elaborate further later on. I will hand it over to Tatiana, who can talk about the Jordan Principle. Thank you. Thank you, Geneviève. Hello, everybody. I am a liaison officer, so I'm just going to give you a first presentation of the role of my colleague. She is an advisor in healthcare services. She does a lot of analysis and informing the communities of different issues in terms of access to services, represent and defend the interests of the First Nations in Quebec for access to services at the regional and national level, identify problems of access to services and support the development of strategies to remedy these situations, and defense of interests. So we were talking a lot about the Jordan Principle. So we help the communities, especially the stakeholders and the members, to navigate through the programs, the Jordan Principle, to ensure access to services at the provincial level. So I work in close collaboration with Marie-Christine, Metaxia, Geneviève, and others, as well as the team from the Jordan Principal. So I'm always available. As I said, I'm a liaison officer, so I accompany people for access to healthcare services. I'm a liaison between core organized professionals and communities. So sometimes I need to communicate with the suppliers, and for example, a dentist, or if I need a letter from a professional or a request for a different organization at the national level. So the Center for Medicine Exceptions at Ottawa are at the national level. I also accompany in letters and paperwork and phone calls. Sometimes I search for healthcare suppliers and specialized care when necessary. Support access programs with the province and development of adapted tools. So the fact that we put in place this toolbox, this Jordan Principal toolbox, so it's available on our website. I'm going to go through it very quickly here, but you have the link to have access to the website for all the documentation, to be able to see everything that's available, and also our guide for processes to access healthcare services. So as mentioned, I'm there to accompany people. I'm always available. If I'm not, my colleague Isabel, we will put her information up on the screen, and there you go. And if you need anything, don't hesitate to contact me. Thank you.